The HeartStart Intrepid can also monitor end-tidal carbon dioxide, or EtCO2. CO2 monitoring is available in AED, monitor, pacer, and manual defib modes, and on both adult and infant-child patients. Consult the HeartStart Intrepid IFU to determine the appropriate cannula and accessories. There are some factors to consider when selecting accessories for your particular sensor: patient type, adult or pediatric; patient airway status, ventilated or not ventilated; and if ventilated, humidified or non-humidified; need for supplemental oxygen delivery; and possibility of mouth breathing. To measure end-tidal CO2, connect the tubing to the CO2 port on the HeartStart Intrepid. Confirm that the patient category is appropriate for this patient. When a sensor is connected to the CO2 port, the measurement is automatically turned on. To avoid inaccurate readings, the CO2 sensor needs to be reset and require a valid zero be performed when a new sample line is attached. There has been significant change in environmental conditions, when accuracy of the reading is questionable, or when prompted by the HeartStart Intrepid. Before zeroing the sensor, remove the sampling line from the patient for at least 20 seconds and remove all sources of CO2 away from the sampling line. Zeroing the sensor can be done by using the Zero CO2 soft key or accessing the zero function using the Smart Select knob. In this case, we'll demonstrate the procedure using the soft key. Confirm the HeartStart Intrepid is in a clinical mode. Then, simply press the Zero CO2 soft key and the CO2 Zero in Progress message appears on the display. The message disappears when zeroing is finished. There are two measurement values associated with EtCO2 monitoring. The first is EtCO2, or end-tidal carbon dioxide, the peak CO2 value measured during expiration. The second is AWRR, airway respiration rate, or the number of breaths per minute. In addition to the values, the monitor displays the CO2 waveform, or capnogram, in the configured wave sector, if available. This is the shape of a normal capnogram. It is important to note that on a capnogram, positive deflections represent expiration, whereas negative deflections represent inspiration, which is the opposite of most respiratory waveforms.